All right, costochondritis. What is it and how do you get rid of it? 30% of emergency room chest pain related visits is costochondritis. It's a chest wall pain. It's also called Costosternal syndrome because there's pain or pain and tenderness upon palpation when you palpate the connection between your ribs and your sternum. So costo, ribs, chondro is the cartilage right here that's connected to the sternum. And basically when you're pressing right through here, you feel pain, or you just have pain in this area right through in here, or this side right here. Now, if you look this up medically, they don't really know what causes it. In most cases, they can't find a cause identified, unless there's some trauma. But what if there's no trauma? And let's say there's no lung infection, you don't have a pneumonia, and you don't have shingles. What could be behind this? There's two things. One is you could be low in vitamin D. Low vitamin D will cause bone pain as a major symptom, probably one of the first symptoms. So if you press on your bone, either at your shin or the sternum or right next to it, and it's painful, you might just need some vitamin D. Or the second most common cause is a problem with something just behind the rib cage. And what do you have behind the rib cage? Well, you have the liver, and the liver is connected to the gallbladder through a little tube. And let's say that the liver or the gallbladder is backed up and there's pressure or it's becoming enlarged. That will most definitely cause pain right on the top part where the ribs are. In fact, when I was in practice, almost 100% of the time, people who came in with costochondritis had it on the right side, which correlates with the liver being on the right side. And inevitably, they had a lot of digestive issues as well, bloating and things that are related to that. So I'm just increasing your awareness on other potential causes other than, well, you know, we don't know what causes it, just take some medication. Now, if it's on the left side, that potentially could relate to your heart. But let's say you get that checked out and it's not connected to your heart's healthy. But guess what? On the left side, you have the pancreas. You have a lot of ducts that work together with the ducts of your pancreas. And so both the left side and the right side could be related easily to some problem with your digestion. And it could be some type of gallbladder sludge that is backing up these ducts or little tubes, which will create pressure and pain. The simple solution, if that's the real cause, is to take some betaine hydrochloride. I would take maybe 3, 4, or 5 right before you eat. You can get it from the health food store. Very simple, safe solution, in addition to some purified bile salts, okay? And you would take this probably on an empty stomach in the morning, and then take 1 or 2 after lunch, and then take maybe 1 in the afternoon. And what that will do is thin the bile sludge to allow for better drainage and ease the pressure and reduce this pain right here. It works like a charm. Definitely want to check it out. I put some links down below for more information on both of these. But of course, check with your doctor before taking anything new, and definitely rule out other problems like heart issues before you kind of self-diagnose. But mainly what I'm talking about, if all these other things are absent and you can't find anything, definitely these are the 2 things I would look at. Before you go, if you have a question about a product, or you're new to keto and you want to know how to begin keto, or you're on keto and you need a debug because it's not going as smooth, I have a keto consultant standing by to help you. This is just for the people in the US. Hopefully in the future we'll be able to answer everyone's call, but I put the number down below so you can call and get some help.